Hello everyone, welcome to today's lesson. Today we are going to see about the management of laryngospasm. So after we are diagnosing that the patient has laryngospasm, the first thing to do is we have to let the surgeon to stop the procedure, and the next we have to call for expert help and prepare the rescue airway. Then we have to continue giving 100% oxygen with non-rebreathing mask. Then we have to remove all the triggering agents immediately. Then we have to give Larson's maneuver. That means apply painful inward and anterior pressure at the Larson's point of the laryngospasm notch bilateral while performing jaw thrust. The other is positioning. That means jaw thrust, chin lift, and head tilt. Then giving continuous positive pressure ventilation or positive airway pressure. We will see this later on. And then if the patient is not relieved so far, we have to deepen the level of the anesthesia by giving propofol 1 milligram per kg IV. And if the patient is not relieved so far, we have to consider neuromuscular blockers with succinylcholine 0.5 milligram per kg IV or 4 to 6 milligram per kg IM if no IV line. Then, if not relieved yet, if not reversed yet, we have to give intubating dose of succinylcholine. That means with 1 to 2 milligram per kg of succinylcholine and intubate the patient under deep anesthesia. And after we are doing this, if the patient is bradycardic, especially in pediatrics, patient suffers bradycardia secondary to hypoxia, so we have to consider atropine with 0.02 milligram per kg IV or IM. Saying this, let's see how to apply CPAP. CPAP means continuous positive airway pressure, which is a form of positive airway pressure ventilation in which a constant level of pressure greater than atmospheric pressure is continuously applied to the upper respiratory tract of person. And when we apply it, we have to hold a tighten fitting face mask against the child face with 100% oxygen delivered with a pressure of 15 to 20 centimeter water dialed into the APL valve. And this pressure in excess of 20 centimeter of water may cause gastric inflation, so we have to measure our pressure. We have to assure that our pressure supposed to be between 15 to 20 centimeter of water while we are applying CPAP. And CPAP is usually applied for 30 seconds and effective. And let's see the laryngospasm maneuver. So when we are applying laryngospasm maneuver, we have to apply firm inward pressure bilateral with both index finger at the laryngospasm notch, which located just behind the elbow, and on the posterior aspect of the mandible here, on the anterior aspect of the mastoid, and on the inferior aspect of the ear canal. And this action exerts pressure on the styloid process and induces laryngeal relaxation, and the laryngospasm supposed to be or expected to relieve after that. And this is the site in pediatrics especially. You can clearly see on this picture, I put it right here. And we have to affirm, or we have to avoid the angle of the mandible which places the finger too low and may threaten them. We have to be gentle, and we have to affirm holding, putting our hand or our finger in the right position. This is for today. This is all about the management of laryngospasm. If you have any question, please comment me on the comment section. Thank you.